patients is $1. No doctors allowed. Insurance company determines the price of all payments.
On February 11, 2011, advocates of single-payer healthcare congregated at Mellon Green, the home of Occupy Pittsburgh. Snow was steadily falling, but that didn't stop a range of insured and uninsured Pittsburghers from issuing the rallying cry, "Healthcare for the 99%."
We're out here just to let the healthcare giants know that they need to be thinking about patient outcomes instead of corporate profits.
I'm here because everybody needs healthcare, and it shouldn't be dominated by big business corporations to make profits off of our misery and to keep a lot of people uninsured.
I don't think that our healthcare system, the way it's set up in this country, is fair or sustainable.
Healthcare for all is our demand. Fight back now and take a stand.
The group marched to UPMC headquarters, and several key figures in the community voiced their support for the movement.
There are nearly 20,000 physicians who are with you today who are supporting the Occupy movement. I want to read the statement from those physicians. We support Occupy because we took an oath to do no harm, and our corrupt political and economic systems are harming us all. We support Occupy because our political leaders, held hostage by corporate money, reject evidence-based health policies such as single-payer reform that would save both lives and money. We support Occupy because the private health insurance industry exemplifies the Occupy movement's central tenet. Its unchecked corporate greed tramples human need.
Healthcare in America is a stain on our moral fabric. 39th in infant mortality, 41st in maternal mortality, 36th in life expectancy, with 47 to 50 million uninsured who have not even the most minimal of health care paid for by insurance plans. About 1/2 of all family bankruptcies caused primarily not by mortgage debt, but by health care costs.
Healthcare for all! Healthcare for all! Healthcare for all! Healthcare for all!
Occupy Romoff's office.
What do we want?
Healthcare!
What do we want?
The ralliers then boldly filled the UPMC building, risking arrest. They protested peacefully and then moved on to the Highmark building to issue another cry for justice.
Highmark profits, people die! Highmark profits, people die!
What do we want? Healthcare!
When do we want it?
Now!
What do we want? Healthcare! When do we want it? Now!
There's only one thing that should stand in between me and my doctor, families and their practitioners. And that is not fear, that is not worry. What should stand between us and our doctors is a walk down the street.
For the people of Braddock, all it took was a walk down the street until UPMC decided to close that hospital in 2009. Now it takes at least 2 buses, 3 to 4 hours round trip, which sounds bad in good health and sounds like a barrier to access altogether in poor health.
My name's Ben. I'm a 21-year-old part-time student at CCAC, and I am an uninsured American. My entire family, my father's 59 years old and he is uninsured and he has a lot of health problems. He went to the hospital last year, and this was when he was still working. He lost his job and he lost his health care. And he got sick, went into the hospital, and they approved him for medical assistance. Well, as soon as his Social Security kicked in, now he makes too much money to be on medical assistance. So he has to use all of his Social Security to pay for health care. It just doesn't make any sense.
I personally know of, I'm in the construction business. Many guys in the construction business are trying to get their children covered, and they are not covered. They live in abject fear every day as they go to work. And they work hard, Newt. They work 2 jobs.
I just want to say how heartwarming it's been that everyone came out today. It really was just awesome, and I think we made a point today. and it's just the beginning. I think this is the first healthcare rally and march that we're going to have with Occupy Pittsburgh, and it's definitely not going to be the last.
That's right.